As a psychiatrist, I sometimes prescribe Seroquel for anxiety, and yes, it works. But there's one long-term effect I see again and again that most patients are never warned about. And if you're in midlife, it can quietly sabotage your health. Hi, I'm Dr. Air, integrative psychiatrist and lifestyle physician. Today, I'm breaking down exactly how Seroquel works for anxiety, why it can feel like a miracle in the short term, and why I'm extremely careful prescribing it long term, especially for adults navigating chronic stress, burnout, or midlife hormonal shifts. I'll also share what I do instead when someone's nervous system is stuck in overdrive. Stick around because in a few minutes I'll explain the one side effect that affects your metabolism in ways that can quietly sabotage your health for years. Let's start with a quick story about David. He had been struggling with severe anxiety related to his ongoing divorce. He came to me after 3 months of barely sleeping. His anxiety was so bad he was beginning to struggle at work. His previous doctor prescribed a few medications for him, one of which was Seroquel at bedtime. In David's words, it was like someone turned off the fire alarm in my brain. I finally slept. I finally felt calm. But 6 months later, he had gained 30 pounds. His fasting glucose was creeping up and he felt flat, emotionally numb. He said, "I'm not anxious anymore, but I don't feel like myself either." David's presentation was likely due to several factors, including the medications he was taking. So let's talk about Seroquel. The generic name for Seroquel is quetiapine. This medication, an atypical antipsychotic, was originally designed to treat schizophrenia and bipolar disorder. But doctors prescribe it off-label all the time for anxiety and insomnia because it works. And here's why it works so well in the short term. Seroquel doesn't just calm your mind, it sedates your entire nervous system. Think of your brain like this chessboard. When you're anxious, it's like every piece is moving at once. Your brain is trying to defend against threats that aren't even there. Seroquel, it slows the entire game down. It blocks histamine receptors. That's why it makes you feel drowsy. It blocks dopamine receptors. That's why racing thoughts quiet down. And it affects serotonin, which is why it can stabilize mood. For someone whose nervous system has been stuck on high alert for months or years, this relief is huge. But here's the problem. Seroquel doesn't fix why your nervous system got stuck in the first place. It just turns the volume way down. And when you do that long term, your brain and body adapt in ways that can backfire. This is because Seroquel changes your metabolism. It affects how your body processes sugar, how it stores fat, how it regulates hunger. Studies show that Seroquel is considered intermediate risk amongst the metabolically disruptive antipsychotics. Weight gain, common, sometimes 20, 30, even 50 pounds. Insulin resistance, it can develop within months. High cholesterol and triglycerides, also common. And here's the part that really concerns me. This becomes more common as we get older. If you're in midlife, especially if you're a woman navigating perimenopause or menopause, your metabolism is already shifting. Estrogen is dropping, insulin sensitivity is declining. Adding Seroquel on top of that could potentially worsen your metabolism. I've seen patients develop prediabetes within a year of starting Seroquel. I've seen women gain 40 pounds on this medication. But let's talk about something else that happens. Seroquel sedates you. Now, for many people, that sedation doesn't just happen at night. It lingers. You wake up groggy. Your brain feels foggy. You can't think as clearly as you used to. One of my patients described it like this. I feel like I'm living life through a thick glass window. I can see everything, but I can't quite reach it. Now, I'm not anti-Seroquel, so let me be clear. Seroquel does have legitimate benefits. There are times when I prescribe it. For people with schizophrenia or bipolar disorder, it can be life-changing. It stabilizes mood. It reduces psychotic symptoms. It helps people function. And for short-term anxiety crisis, it can provide immediate relief when nothing else works. It quiets the racing thoughts. It breaks the insomnia cycle. It gives your nervous system a chance to reset. I've seen patients who were completely unable to sleep for weeks Finally get rest with Seroquel. So I'm not saying it's a bad medication. I'm saying it's a powerful medication, one that should be used strategically, not casually. The problem isn't Seroquel itself. The problem is prescribing long-term without addressing the root cause and without monitoring the metabolic consequences. This is why, when feasible, I use it in the short term, low dose, and I monitor metabolic markers closely. I check fasting glucose, hemoglobin A1C, lipid panel, weight, and I'm always asking, what's driving this anxiety in the first place? Is it chronic stress that's been building for years? Is it inflammation affecting the brain? Is it a gut-brain issue, dysbiosis, leaky gut, food sensitivities? Is it hormonal, perimenopause, low testosterone, thyroid dysfunction? Is it mitochondrial, meaning your cells aren't making enough energy? Because if we don't address those root causes, you may need to be on medications indefinitely. So what do I do when a patient comes to me? First, I stabilize the nervous system naturally. A few options include magnesium glycinate, 200 to 400 milligrams at night. This calms the nervous system without sedation. L-theanine, 200 milligrams, promotes relaxation without drowsiness. Ashwagandha, an adaptogen that lowers cortisol and helps the body handle stress. Omega-3s, EPA-rich fish oil reduces brain inflammation. Second, I address sleep architecture. If you're not sleeping, your anxiety will likely continue to be an issue. I use sleep hygiene protocols, light exposure timing, and sometimes low-dose trazodone or mirtazapine medications that help sleep without the metabolic cost of Seroquel. If you're struggling with sleep and anxiety, I've created a free guide that walks you through the exact steps I use with my patients. It's available as a free download in the description below. Third, I look at inflammation and metabolic health. High sensitivity CRP, hemoglobin A1C, vitamin D, RBC magnesium, B12, folate, thyroid panel. Fourth, I recommend nervous system regulation, breath work, vagal toning, somatic practices. Your nervous system needs to learn it's safe again. Medication alone won't teach it that. If you're already taking Seroquel, don't panic and don't stop it suddenly. That can cause rebound insomnia and anxiety. Like all medications, Seroquel has side effects, but it could also be life-saving. You need to discuss with your doctor if you're on Seroquel or considering getting on it. Remember David, the guy who gained 30 pounds and felt emotionally flat? We tapered him off Seroquel over 3 months. We fixed his sleep with magnesium, trazodone, and a strict sleep schedule. We addressed his gut inflammation. We added ashwagandha and omega-3s. 6 months later, he had lost 22 pounds and his glucose normalized. That's what happens when you treat the root cause, not just the symptom. So talk to your doctor about root cause options and also monitoring your metabolic health. If your doctor feels you need to stop this medication, then ask about tapering slowly while building other supports. Never stop Seroquel cold turkey. Always discuss with your mental health provider. In many cases, a combination of Seroquel and an SSRI can be life-changing for someone with severe anxiety. To learn more about one of the common SSRIs, check out this next video.